Federal Drug Enforcement Administration puts drugs into five categories, what are called schedules. It's based on their medical value and potential for abuse and addiction. Right now, marijuana is in the most restrictive category, Schedule 1. That's the same category as heroin and LSD. Schedule 2 includes fentanyl and cocaine. 3, Tylenol with codeine, steroids, and testosterone. 4, Xanax and Valium. And 5, over-the-counter medications like Robitussin. Last year, the Biden administration proposed moving marijuana from Schedule 1 to Schedule 3. That wouldn't make it legal on the federal level, but would ease federal restrictions. Bo Kilmer is the co-director of RAND's Drug Policy Research Center. Mr. Kilmer, I want to examine what this would do, moving from 1 to 3, what it would do for various groups. First of all, what would it do for individuals, whether they're using marijuana recreationally or for medicinal purposes?
It wouldn't make much of a difference. Realize that while 24 states have legalized cannabis for adult use, and we've got 40 states that legalize it for medical use, all of that activity at the state level is still illegal under federal law. So if we were to move at the federal level from Schedule 1 to Schedule 3, that wouldn't necessarily change what's happening at the state level.
And then for businesses that sell dispensaries or other businesses that sell marijuana.
They would benefit from this. There's a part of the Internal Revenue Code or the tax code which specifically says that if a entity is trafficking a Schedule 1 or Schedule 2 drug, that means that they can't deduct normal business expenses on their federal taxes. So if you were to move cannabis from Schedule 1 to Schedule 3, those businesses would then be allowed to deduct those expenses. They'd make more money. And on the public health side, there's a concern that what that would mean is that these businesses would then be able to write off advertising and marketing. So we'd see more promotion.
And what about for medical research and pharmaceutical companies?
Yeah, so in general, you can do research on Schedule 1 drugs, but it turns out there are a lot of hoops that you need to jump through. And so in general, if you move from Schedule 1 to Schedule 3, it should reduce some of those restrictions, reduce some of those administrative barriers. However, the Congressional Research Service came out last year and said, look, there was a law that was passed or a bill signed into law in 2022, which was specific to doing research on cannabis. And so their takeaway on this is that moving cannabis from Schedule 1 to Schedule 3 isn't going to make much of a difference. That said, some may argue that by moving it from Schedule 1 to Schedule 3, there could be less stigma, so some researchers may be more likely to get involved. But even if on the margins this reduces administrative barriers, and if more people get involved or want to get involved in research, the bottom line is who's going to pay for it? The National Institutes of Health, they fund a lot of the research on cannabis. And so a big question remains is, will there be money there to support this research?
The Gallup poll's been asking this question about public support for legalizing marijuana for some time. In 1969, only 12% supported that position. By 2023, 70% supported it. You've been studying drug policy for 20 years. How has the politics of this issue changed?
It definitely has become more bipartisan or nonpartisan over time. Early on, this was much more kind of a liberal or left issue, and definitely is much more mainstream today.
Given the fact that the president doesn't use alcohol and talks about the effect of alcohol on his brother, Fred, does it surprise you that he's coming out talking about reclassifying marijuana?
Not necessarily. People have been just talking about rescheduling cannabis for decades. And, in the previous administration, they were taking this seriously. It stalled out, at the end of the administration. So it's not surprising that this is a topic of conversation, especially given where public support is for legalization.